Hey everybody, Dr. Jonathan Fabian here with Health Source of Riverton, and I'm back to talk with you about our condition of the week for this week, which is actually shoulder pain. So when we're having shoulder pain, life gets really tough, you know. Our kids want to play, our dog wants to play fetch, and you go to throw that ball or pick up a kiddo or something, and man, that bites you. And so there's a lot of different things that can cause shoulder pain. There's some major things that are the most common. One of them is actually called impingement syndrome. That happens normally if you have impingement syndrome. You'll notice that you don't have much pain when your shoulder's all the way down, and once you get it clear up, it doesn't really hurt much either. But that in between, there's a place in there that gets really sore. They call that a painful arc. That's because the shoulder joint isn't moving correctly and has been displaced, or the shoulder blade isn't moving well. So that's something definitely to have looked at. In addition to that, shoulder pain can be caused from the neck or the mid-back, and that pain actually kind of trickling down into the shoulder. So sometimes what you're feeling as shoulder pain isn't shoulder pain at all. It's a symptom of a problem somewhere else. Another thing that we see in our patients is called frozen shoulder. So frozen shoulder happens usually after an injury. It's most common in diabetics. However, anyone can get it. And what happens is you actually get a piece of scar that forms between the joint of the shoulder and the capsule around the shoulder. And so it restricts your movement. It can be really painful. It can feel like a searing or burning sort of pain with certain movements. And so that's another one that's really important to get looked at. And of course, arthritis can really be a part of that. So chiropractic is really uniquely situated to help you with shoulder pain because, number one, we can do a really good job of diagnosing whether it's actually neck or mid-back pain or if it really is shoulder pain. Second, if you are in fact having shoulder pain, impingement syndrome is really highly associated with problems at the shoulder blade, which of course corresponds to problems in the rib cage and the mid-back. So we can address those things in addition to some specific exercises for the shoulder. If you're dealing with arthritis, movement is the best thing you can do to treat arthritis. And so getting that adjusted and getting motion back in there is really important. And of course with adhesive capsulitis, we've got some great exercises as well as some adjustments to try to break that scar tissue loose so that your shoulder moves again. So if you or someone you love is experiencing shoulder pain and difficulty getting through life as a result of that, please have them give us a call. We'd be happy to evaluate them and see if we can help them through this time. Thanks, and have a great week.